in January of 2013, I started having some difficulty, with a little numbness, a little discomfort in the back. So my internist recommended I have an MRI, and as a consequence, she discovered that I had some stenosis in the lumbar region, and but they didn't do any treatments of any kind at that point in time. And then about sometime in March, I started to, I take that back. A little bit earlier, we went back to the therapist, and because things started to deteriorate, and she recommended physical therapy. I went to physical therapy, had 12 sessions, and by the end of, near the end of May, and near the end of April, I started really having some serious pains. I was crawling on all fours at home. I was sleeping on the floor. I was just very, very uncomfortable.
So and evidently the therapy didn't do.
Yeah, the physical therapy.
Much help.
The physical therapy did not assist me at all. And so then, in the interim there, I also had tried to get an epidermal, and the stenosis was so narrow that he couldn't get it in the targeted area, and as a consequence, that was unsuccessful.
But prior to that, we had gone to the internist prior to the epidural,
right.
And he was in real bad shape at that point. I mean, he could barely walk. And so she decided to give him a prescription for a wheelchair, and then she prescribed oxycodone for the pain. And she said, in the meantime, perhaps you should see a pain specialist. So we went home, got the wheelchair, and Jim started on the oxycodone. And what happened was, he began to be very sleepy, very fatigued. He was basically in a stupor. It was terrible, just terrible. So then we went to the pain management.
Yeah,
and he tried the epidural.
And that didn't work. And so eventually what happened is that, I guess, was it you or Pam, our daughter?
Someone took, I think my daughter took a picture of Jim sitting in a wheelchair in the family room. And she sent it to our son. And our son was doing his residency down in Georgia, his medical residency. So he calls me up as soon as he gets the picture, and he goes, "What's going on? This isn't my father. What's my father doing in a wheelchair with his head down?" And I said, "Well, such and such has happened, Alex. We don't want to bother you." He goes, "Okay, hold on." He goes, "I'm going to call you tomorrow." Calls us tomorrow, and he says, "You are going to go see Dr. Perry Cammisa." I said, "Who's Dr. Perry Cammisa?" He said, "I found him on the internet. He is a biomechanic chiropractor. He is one of a kind. That's who you're going to see. Do not see anyone else." He says, "Just Dr. Cammisa. And go now." So we called up and made an appointment. And I wheeled him in.
And that was May 20th of 2013. And initially, they put me through a protocol. And what I have to tell others that may have had, similar, difficulties, is you have to be able to tolerate a little pain, but that's part of the process, and that will go away in time. And as it turns out, they worked with me 5 days a week, and by August 2nd, I was golfing. Okay, so here the orthopedic guys, they wanted to do surgery, okay? And here I am to tell my story, that I was able to avoid surgery. I feel terrific as far as my back is concerned. I'm still seeing Dr. Cammisa, and I guess this is going to be a lifetime commitment.
And I have to add, too, not to interrupt you, but we also tried acupuncture, and that did not work. Needless to say. So we tried many things in the interim.
So I had 12 sessions, with the physical therapist, and I had 4 sessions with the acupuncturist, okay? And none of those procedures, assisted me in any way. My only salvation is, thank God for Dr. Perry Cammisa.
So when we came here, Dr. Cammisa said 5 days a week to start out with. And so thankfully Jim has a lot of friends and we have relatives that live around us, and so we set up a carpool. So Jim could come here for 5 days a week.
And thank God
The rest is history.
it wasn't too long before I was able to drive on my own. This way I didn't have to rely on my wife and have a heart attack in the process.
We'll take care of him later.
That is absolutely perfect.